What's wrong with me?
Miss Hill. Miss Hill. Now why do you come to visit me at the clinic today?
I don't know what's wrong with me. I mean, it began with just my hands trembling, and then the rest of my limbs would go stiff. Some days it feels like I'm moving in slow motion, and I can never seem to stay balanced on my own 2 feet.
Any change in your routine other than the symptoms you have told me? For example, are you eating normally?
I would say my appetite has increased a bit, but I'm always snacking, so it's hard to say.
Is there any other abnormal occurrences that you can remember?
Maybe it's just my body reacting to the warmer weather, but I feel very uncomfortable in my skin, especially in the heat. I mean, it always feels like really sweaty and oily and just gross.
Okay, any change mentally?
I think I feel a bit more on edge and frustrated because my emotions just seem way more vulnerable than they used to be, and I can't seem to control my mood at all.
Okay, given these symptoms, I believe now we should run some tests.
Parkinson's disease is a slowly progressive, degenerate neurological disorder caused by the unknown death of nerve cells in the brain. These nerve cells produce dopamine, a chemical that sends signals to coordinate muscle movements. Parkinson's disease is characterized by the resting tremor, pivoting of the fingers, mask-like faces, shuffling gait, forward flexation of the trunk, muscle rigidity, and weakness. Symptoms include trembling of the hands, arms, legs, and jaw, slowness of movement, poor balance, stiffness in the torso, arms, and legs, drooling, increased appetite, intolerance to heat, oily skin, emotional instability, defective judgment, and fatigue.
Hello, Miss Hill. I'm Dr. Perrin, but you can call me Shayna. I'm a neurologist, and today we're going to run some tests and neurological examinations and find out what's wrong. Do any illnesses run in your family?
Well, my grandmother was diagnosed with Parkinson's disease when I was 10, and I'm not sure about my great-grandparents, but my parents don't have it, so I shouldn't either, right?
It's unclear, but we're not going to diagnose anything yet, not until we've run the tests. So I'm going to ask you to perform a couple everyday activities just to see if you're functioning properly and if your body's coordinated. Ready? Let's begin.
The diagnosis of Parkinson's disease is made by a combination of neurological tests and observing the patient's medical history. The main test is called the Unified Parkinson's Disease Rating Scale. For this, the patient must answer questions about their symptoms, and the doctor must examine the patient for symptoms while performing everyday tasks. Technology used to help diagnose Parkinson's is a PET scan, otherwise known as a position emission tomography. For this technique, the patient is injected with a chemical that causes the dopamine neurons to light up when viewed in the scanner. If a doctor observes relatively low numbers of dopamine neurons on the scan, the patient probably has Parkinson's. This piece of technology has greatly benefited diagnosing Parkinson's because technology such as an MRI, a CAT scan, or even a simple blood test can rarely detect any signs of Parkinson's. Sadly, this technology is very expensive and can only be used to detect Parkinson's, not prevent it.
Miss Hill, I'm sorry to inform you of this, but after the test results have come in, and I'm afraid that the conclusion is you have Parkinson's disease.
What? But my parents don't have it, so how can I?
Well, it's an autosomal recessive gene. Therefore, your parents don't express the disease because they also carry the dominant trait. However, you're diagnosed with the disease because you have both of the recessive traits.
But this can't be happening. I mean, what caused this?
Well, there are a number of Parkinson's variations. However, they're all caused by neurons producing dopamine in the brain, dying due to mutation in the genes. Now, this relates back to symptoms you've been having because the dopamine in your brain is the chemical that sends signals to coordinate movement.
So is that why my hands have been trembling, my body has been like freezing?
Yes.
There are 10 different types of Parkinson's disease caused by genetic mutations. However, there are other causes such as environmental triggers that can contribute to the development of Parkinson's disease. or a mixture of both. Types of Parkinson's disease include Park 1. For this, patients inherit 3 copies of the alpha-synuclein gene located on chromosome 4. This gene is involved in the regulation of dopamine released in transport. This extra dose of alpha-synuclein causes abnormal clumping of protein, also called Lewy bodies, to form and kill the dopamine neurons, causing patients to develop Parkinson's disease at an early age. This was discovered in 1997. The mutation was found in large Italian and German families. Park 6 is another type of Parkinson's disease. This disease targets one side of the body, first beginning with tremors. STO1 is another gene responsible for the late onset in both Parkinson's disease and Alzheimer's disease. For these genes, Park 1, 3, 4, 5, and 8 are inherited by autosomal dominant genes. In Park 2, 6, and 7, they are inherited by autosomal recessive genes. Let's assume for this situation that Ms. Hill's grandmother has Park 2, an autosomal homologous recessive trait, and her grandfather has the homologous dominant traits. Therefore, her grandmother has Parkinson's. With these given genetics, it can be determined that Ms. Hill's mother has heterozygous traits for Park 2. Now, assuming that her father also has the heterozygous traits for Park 2, that leaves Ms. Hill with a 25% chance of having both recessive traits, and sadly having Parkinson's disease.
But we can fix this, right? I mean, there has to be some sort of cure.
Well, no, but there is medication and speech therapy and physical therapy. We'll help you manage your symptoms. We'll find the right medication that has the least amount of side effects.
So what kind of treatment do you recommend?
Well, a palliative and symptomatic treatment works best. It focuses on correcting the imbalance between the depleted dopamine, but I'd like you to bring your parents in first so we can discuss more treatment options.
Okay.
At this moment, there is no cure for Parkinson's disease. However, there are many treatment options that can reduce the symptoms. These treatments include medication, surgery, and a variety of therapies. These medications include levodopa, the primary drug to treat Parkinson's disease, that is a dopamine precursor. It helps to relieve rigidity, tremors, bradykinesia, mask-like facial expressions, scant problems, and clamped writing. Side effects include dyskinesia, involuntary breathing movements, severe nausea, vomiting, rapid heart rate, and low blood pressure when standing up. Anticholinergic drugs are used as therapeutic agents. Side effects include anesthesia, blurred vision, constipation, dryness of the mouth, mental disturbances, slurred speech, and urinary urgency. Antanedione hydrochloride is an antiviral drug which promotes the accumulation of dopamine in extracellular or synaptic sites. Side effects include mental confusion, visual disturbances, and seizures. Surgery consists of making license at various points in the brain in order to decrease tremors. The surgery is focused on 2 areas called the globus pallidus and the thalamus. Destroying these parts reduces tremors and rigidity. It is a high-risk method which could result in the patient being paralyzed or death. However, it is used when the medication is no longer effective. Types of therapy include physical and occupational. These methods help the patient adapt to movement problems, teach methods of reducing the effects of the tremors, and compensate weaknesses during everyday activities. Speech therapy can help improve their speech that can be disrupted due to their symptoms. This method is called the Lee-Silverman voice method. It increases speech volume in the patient by exercising their voice box. Improvements can last up to 2 years. Alternate therapies include massage therapy, Tai Chi, and acupuncture, which all help the patient relax, balance, and coordinate. Gene therapy is used to infuse billions of virus cells containing copies of the human gene into the brain in order to stimulate cells to produce gamma-aminobutyric acid. This will calm overreactive nerve cells and reduce symptoms. The first operation was in 2003 at the New York Presbyterian Hospital. Some concerns are the adverse effect of the virus and the genes. For example, several children in France developed leukemia after gene therapy.
What the hell is wrong with her? I don't know. She's like ridiculous.
Freak!
Why is she shaking? Something wrong.